Which of the following pathological explanation best describes the initial pathological process occurring in abdominal aortic aneurysm in an otherwise well 65 years old hypertensive male? So abdominal aortic aneurysm, it is pathology of the aorta, and we have to find out the initial pathological process or the initial change in case of abdominal aortic aneurysm development. Here are the options. Options are loss of elastic fiber from the adventitia, loss of collagen from the adventitia, loss of collagen from the media, loss of elastin fiber from the media, and decreased matrix metalloprotein is in adventitia. So we have to find out one of the answering option. First of all, let's see the normal blood vessel. So in case of a normal a healthy blood vessel, here we can see this is a normal a healthy blood vessel, and in case of normal healthy blood vessel, we can see most outer layer, which is the adventitia, then middle layer, which is the media, and most inner layer is the intima. And the intima, it is very thin layer relating to the other two layer. And here we can see the intima, it is formed only by the endothelial layer, and then media and adventitia. So what happened in case of when there is aneurysm development? So here we can see the aneurysm, that means the dilatation of the vessel wall, and this dilatation may be saccular, that means like a sac formation. Here we can see it is a saccular, then fusiform, that means it is dilated on the whole side. It may be dissection, that means the intima layer is tearing and blood goes to the media layer, or it may be false aneurysm, that means there is the, here we can see this is the false aneurysm, that means there is extravasation of the blood and extravasated and the extravascular connective tissue. So what happened in case of the aneurysm? In case of aneurysm, what happened? Actually, this part of the wall, one part of the wall, like this part of the wall weakened. So when this part of the wall weakened, then what happened? This wall is enlarged. The segmental part is enlarged when it cannot tolerate high pressure. So when there is loss of the different substances, different connective tissue from the media layer, so in this condition, what happened? This part is dilated. So let's see the pathology of the abdominal aortic aneurysm. The abdominal aortic aneurysm occurs primarily as a result of failure of the elastin protein within the extracellular matrix. So when there is loss of the elastic protein, or there is deficiency of the elastic protein in the extracellular matrix of the vessel wall, extracellular matrix of the vessel wall, it is the initial pathology. And the aneurysm, it represents the dilatation of the wall layer of the arterial wall. We know in the arterial wall, three layer, which is the adventitia, media, and intima. And in the second picture here, we can see the wall layer are dilated. Also in the third picture here, we can see the wall layer is dilated. So most aneurysm caused by degenerative disease, that means the elastin protein which is present in the media layer, they are deficiency by different type of the degenerative disease. And what occurs after the age of the 50 years, normal diameter of the infrarenal aorta is 1.5 centimeter in female and 1.7 centimeter in a male. So what happened? It is 1.5 centimeter in case of female, and it is 1.7 centimeter in case of male. It is the normal diameter of an abdominal aorta. And when this diameter is more than 3 centimeter, so it is considered the aneurysm, and there is a risk of rupture of this aneurysm. So what is the primary event? Here we can see in the marked in red, which is the loss of the elastic fiber. It is the loss of the elastic fiber from the tunica media. And what are the major risk factors? This is also important, that what are the major risk factor of the aneurysm. The risk factor, it includes the smokings, It includes the smoking, and second one is the hypertension. So hypertension and smoking, they are the risk factor of the development of abdominal aortic aneurysm. But other causes such as the syphilis and connective tissue disease such as Ehlers-Danlos syndrome and Marfan syndrome. So what happened? Primary event again, here we can see first of all the elastic fiber degeneration, then collagen fiber degeneration. So two important degeneration. First of all, it is the degeneration of the elastic fiber, and the second one is the collagen fiber. So collagen not first, the E for elastic fiber, it is the first. Again, see the wall, and here we can see the inner layer, which is the tutica intima, then medial layer media, and adventitia, which is the most outer layer. And in case of the abdominal aortic aneurysm, this happens in this layer, that means in the media layer. And in the media layer, first of all the elastic fiber, it is degenerated, and the second one, which is the collagen fiber. So what is the initial event? The initial event is loss of the elastic fiber. Here this point is very, very important. It is the elastic fiber, not the collagen fiber. So it is the elastic fiber. First of all, it is the elastic fiber. So what is the initial pathological process in case of the abdominal aortic aneurysm? It is the loss of the elastic fiber from the media. Thank you.